Namaskar. We are on the 6th day of our COVID health webinar series, and delighted to introduce Dr. Anupama today. So I will just get her resume. So Dr. Anupama Kaul, a warm welcome to you. So I'll briefly introduce Dr. Anupama Kaul before we start with the questions. As usual, my co-host is Nija Kaul Sadhuji. Welcome, Nija ji. So Dr. Anupama is, she trained in Jammu, that is excellent. And now she's based in Arkansas, USA. She's a pulmonary critical care and sleep specialist and also the medical director of the ICU and the medical director of the sleep center. Welcome to you, Anupama ji. There are going to be a lot of questions for you, Namaskar, for you today, because you are a specialist, and specialists are in demand in these COVID times. So you are a pulmonologist, which really means that anything from starting from the windpipe to the lungs, you are an expert in that. And COVID primarily is a lung disease, as we know. So to start off the discussion, like we said, Dr. Kaul, we've got awesome audience joining us on Facebook, so we'll be taking questions as we go. But just to start this off, so your specialization is lungs and lung disease. So, and this COVID has caused a lot of havoc to the respiratory system. So do you want to take us through what is the kind of pathology of the lung disease in COVID-affected patients, where it starts from the nasal cavity and how it goes down, and what is the trajectory of the illness in relation to the lung parenchyma?
Sure. So should I speak in Hindi, English, both?
Yes,
Kashmiri,
yes, of course.
थोड़ी Kashmiri भी. It's
Yeah,
all a
that
Kashmiri audience.
Kashmiri
जितना भी मेरे को कश्मीरी में, alveoli को कश्मीरी में क्या बोलते हैं, I don't know, but so okay. So I'll try to be bilingual, maybe trilingual and all of that. So jo COVID, the coronavirus, it is one of the coronaviruses. There are a lot of viruses in the world. Actually, there are more of viruses than human beings on this planet. So this coronavirus, we all have seen these images on Google and on the TV that it has spike proteins. So अगर आपकी intact skin है, आपको skin से नहीं हो सकता. Intact त्वचा है, अगर त्वचा skin intact, तमसे चुनगासा. It has to go through the lining of the mouth and nose and the lungs. वो जो lungs में receptor होते हैं, lungs मंचे receptor आसान ते मंचे वाना ACE2 receptors. You don't need to go into the depth and all of that. So coronavirus च आसान spike. So spike च करान attach to receptor asman. Pat च सु क्या करान ये च coronavirus त्रावान पनुन RNA material cells अंदर. So pachu bad clever so coronavirus. So kya chikaran pachuanan, hey, Mr. Cell, nucleus, mere jaise spike protein, mere jaise or copies banao. So what happens? It takes the machinery of our own cells, lung mein, and then it replicates. It replicates using our own material, and in that process, jo cell hoti hai, hamari jo cell hoti hai, it dies. So that is how it causes trouble in the lungs and elsewhere as well. Then when it makes enough copies, then it breaks the cell dies, and many copies are released. So it multiplies and releases. So what happens is inside of the lungs, is in lungs chinasan, so it just expands you. So there is a bronchial tube and it divides. So divide karti hai or those usme right and left lung. Or chota or divide karti. It's like a tree. So towards the end, क्या होता है वो छोटे-छोटे sacs होते हैं, उसको हम alveoli बोलते हैं, छोटे-छोटे sacs, वो microscopic होते हैं, उस पर gas exchange होता है, तो वो क्या होता है एक alveoli जैसे round है alveoli, उस alveoli के साथ एक blood vessel है, और वो blood vessel और alveoli का बीच में एक पतला सा membrane है, जैसे onion का छिलका होता है ना, पतला वाला जो transparent छिलका होता है वैसे होता है, तो वो आपने so oxygen gets under there. Here exchange takes place. It's a very efficient mechanism, very efficient in the sense we have God gave us two lungs, so agar surface area, because of this mechanism, agar hum alveoli ka sara surface area dale, it will go and to the size of a tennis court. Itna hai. So this whole thing is packaged into our lungs, a chest wall, and that sort of a thing. So just imagine ki itna sophisticated mechanism hai, but the virus is also sophisticated. It replicates inside, causes a lot of trouble. And then, you know, we have low oxygen saturation. Oxygen low इसलिए होता है क्योंकि जो ये mechanism है alveoli और gas exchange का, इसमें swelling हो जाती है. इसमें what we call medical terminology में अगर कोई doctor देख रहे हैं, diffuse alveolar damage. So diffuse मतलब सारी जगह होता है, alveoli वो sac होते हैं, वो damage होता है, swelling होती है. तो वो barrier जो है, जो पतला सा है, वो ज़्यादा हो जाता है. So you need more oxygen to absorb. Now, why is oxygen important? Oxygen is the fuel which runs our cells and stuff like that. You know, छोटे cells है, फिर ATP बनाता है, उससे हमारा वो ईंधन है जो हमारी body उससे चलती है. And there is like the room air has 21% oxygen. So वो हमारे लिए sufficient है. अगर हमको कोई disease नहीं है, हम healthy है, हम लोग jogging करते, कुछ नहीं होता. जब ये disease या कोई और disease भी हो जाए होती है, so you need more oxygen from the outside. And that oxygen is provided by, there are different interfaces. Nasal cannula होता है जो normal जो nose में लगाते हैं, right? फिर एक high flow होता है जो high flow rates हो सकते हैं. और उसके बाद फिर होता है pressurized, that is CPAP या BiPAP होता है. And then eventually that is the mechanical ventilation. That is the last. So this is in a nutshell how. And one more thing I would like to add, it not only affects the lungs, it is also, you can see loss of smell, loss of taste, you have diarrhea, you have rashes. To give you an example, last year जब ये corona हुआ था, हमारे hospital में जो PG students थे, 7-8 of them got sick, or 2-3 of them had rashes. किसी को side में थे, किसी को arm में थे, so that sort of a thing. It is not सबको सारे जैसे symptoms होंगे, थोड़ा different भी होता है. Yes, it is now the newer strains, it is affecting the lungs rather quickly. So we don't have to panic. We just have to know, we can walk you through कि क्या करना है. And most people will recover. I mean, we have, because media highlights इतने सारे, problems हो गए, इतने सारे लोग बहुत sick है, but what they are not telling you कि कितने सारे लोग ठीक हो गए. They are not telling you that. I mean, if you talk to your family and friends and all of that, you will say more, but that is never shown to the media. So this is creating a panic, and panic se kya hota hai, nothing is, you're not going to help anybody. You have to be calm. जैसे आप एक airplane में जाते हैं, right? आप airplane में तो airplane में so air hostess क्या चवना? First, पहले अपना oxygen mask लगाओ, फिर दूसरे का, right? If you have a child on, it says पहले अपना oxygen. So you have to be calm. अगर आप panic हो जाओगे, तो आप दूसरे को कैसे help करोगे? So you have to be okay and calm and composed, and then do whatever you can and help others as well. So I'll stop at that.
So thank you, Anupama. That is wonderful. So like you said, one of the first signs can be loss of sense of smell and taste, and then it goes to the lungs. So is that because it is initially starting to affect the receptors in the nose and the mouth? What is the
yes, it has started to affect the receptors in the nose and the mouth. So you will have loss of smell and loss of taste. Not everybody. A classical example है कि एक physician था, ER physician, यहाँ पर किस East Coast में. He used to go to work every day. तो उस time last time spring में वो cherry blossom होते हैं Washington DC में. तो वो जा रहा था काम पर, एक दिन वो बाहर गया तो उसको स्मेल ही नहीं हुई चेरी ब्लॉसम की, तो उससे उसको लगा ओ मेरे को कोरोना. ही wasn't that sick or anything, he recovered okay, but that was his symptom कि मेरे को चेरी ब्लॉसम की स्मेल ही नहीं आई. oops, this could be corona. So there are those kinds of things which you have to be aware, but this is a classic example. उसको हुआ, he was a little bit sick, he never went to the hospital, he recovered at home. I don't think he even needed oxygen.
Yeah, so a lot of people are having that and that is one of the symptoms of COVID. So then,
one question I have. Sorry, I have a question. You know that in US we have this flu season, and during, as you said, it just came to me suddenly that the blossoms and the blooms and everything. There's a lot of allergies that are seeping in, and a lot of people are getting sick. How does one differentiate? Because a lot of symptoms are similar. I may not have a COVID, but you know that these things can trigger a lot of, such kinds of reactions, or body reacting to these pollen outside or the blooms outside. So how does one differentiate, and is there any guideline for general public like me? Okay, you know what, this is where you should see the difference.
So the difference is that if you are just purely allergic reaction, आप बाहर गए and all of that, you're not going to have fever. Pollen के साथ fever नहीं होता है. So अगर आपको punes आ रहा है और नस बह रही है and all of that, and there is no fever, and then आपको what we call as a post nasal drip, तो पीछे से लगता है कि वो drip हो रहा है, and you feel the need to clear your throat. उस टाइम पर and all of that, and probably has a history of allergy, कभी-कभी न्यूड भी develops हो जाती है, तो वो no fever in this that sort of a thing. You are not going to have oxygen levels that will drop when you have allergy. और कुछ लोग को पहले से ही है ये allergies and all of that, तो उनका seasonal होता है, तो you can see everybody is a little bit different. तो किसी को nose में ज़्यादा होता है, किसी को post nasal drip ज़्यादा होता है. If you're having the similar symptoms that last few years, probably it is the same. But let's say you have this and you have the COVID as well, you're going to have fever. So when you have fevers, that's a red flag. That is that you have to be careful. Flu season ab khatam ho gaya. यहाँ पर flu season, you're not seeing flu. But one interesting thing that we have seen in the United States, perhaps in India too, because वो mask लगाया है, majority of the people, we had no flu deaths in my hospital. Probably similar things. Flu to dekha, ek aad dekha, and not very sick because, barrier is there. So that was one wonderful thing that happened during this time.
Actually, very heartening to know, because the numbers that I heard last year, I wasn't aware of that so many deaths happened because of flu in the US.
Yeah, flu, people die of flu. Elderly people, I've had people, my patients have died, in their 70s and 80s. Of course, जो मेरा patient population है यहाँ पर, वो सारे smoke करते हैं, सबको COPD होता है, and सबको lung disease होती है. And even many of them have come out of corona virus. They have had been sick, और वो तो मानते नहीं हैं. They're very neat, keep on smoking, बहुत हम लोग try करते हैं and all of that. But one thing that, for India, कि अगर कोई smoker है, you should just stop smoking. कैसे कुछ भी करके just stop, because it is, you just आ बैल मुझे मार करके problem है.
So now somebody has tested positive. So there is a mad rush for getting investigated. It's investigations on demand, especially the CT scan. We will have to talk a bit more about the indications of HRCT in India, because it looks like as soon as people are getting the test result as positive, then the next thing is, do I need a HRCT or not? So before going on to the CT, can we talk a bit about the blood tests, which you think are absolutely necessary to have in the first stage of the illness, and then we talk a bit about the CT and its indications.
So let's see, you're at home and you have fever, आपको 101 fever है, 102 fever है, and you are like 45, 46, you have your oxygen saturation is 98%. You really don't need to do anything. आप थोड़ा सा paracetamol ले लो, I think it is whatever it's called in India, Dolo, and keep yourself nicely hydrated. Take if you are taking any medicines, take that. Nothing to do with diet. Dahi khao, आप zamudad khayu, zat salmon khayu, leather salmon, or no change in diet. You do not need a CT. You do not need any blood work if you are just having fever and nothing else. You have no shortness of breath, nothing. Now, if your oxygen level by second, third day starts to go below 94, and you have shortness of breath, and you have persistent fevers, then you go and get your this COVID test. If the antigen is positive, you don't need an RT-PCR. Positive hai to positive hai, right? If the antigen is negative, if you are symptomatic, and then you can consult with a doctor, then you may need a RT-PCR. अब एक क्वेश्चन आता है कि बहुत सारे लोग बोल रहे हैं RT-PCR नेगेटिव आ रहा है, तो तब CT स्कैन कराना है कि नहीं? So if you have all these symptoms that I talked about, fever nahi utar raha hai, paracetamol khaya, oxygen level low ho raha hai, 94 se low ho raha hai, or ye shortness of breath hai, and RT-PCR is negative, and I'll tell you later why that can be negative, then that is the time, third, fourth, then that is the time to do a CAT scan, because you want to catch this early, and you want to be vigilant and not panic and all of that. Now, RT-PCR can be negative because of 2 or 3 things. एक तो टेस्ट कैसे किया है, अब इतने सारे टेस्ट हो रहे हैं, तो so there is a human error in every of these tests, जो भी टेस्ट हम करते हैं, because it is done by a nasal or throat swab. तो अंदर गया है अच्छे से कि नहीं, ठीक से कराया है कि नहीं, that is one thing. Another question which we don't know is, do these variants, are we able to catch them? But looks like जो टेस्ट हो रहे हैं, कितने सारे पॉजिटिव आ रहे हैं, वो most likely it is there. So the technique and and if you do it on the first day, वायरस अभी मल्टीप्लाई नहीं हुए थ्रोट में और नोज में इतना कि इट कैन पिक अप. सो आपको एक फीवर हुआ आज 99, आपने आज जाके टेस्ट कराया, इट कैन बी नेगेटिव. The virus had not had time to multiply. So don't be in a rush. Just logically, it's very logical. आपको fever है, वो है, ये है, ठीक है. आप paracetamol लो, flu is लो, ये सब. And if you're getting better, you don't need. Not everybody needs a test. You overwhelm the system. You overwhelm the CAT scanners. You overwhelm the labs and all of that. And a sicker person may need that. So we have to be considerate. We are all in this together. So जैसे मेरे को fever है अभी 99, right? मैं ठीक हूँ, मैं isolate किया अपने आप को and all of that, and maybe I did a antigen and it is positive, but I'm fine. I'm not going to go for a RT-PCR. I'm not going to go for a CAT scan or anything. I'm healthy, and within 3, 4, 5 days I should be fine. I may be fine, that sort of a thing. Now, the people that you have to worry about are those elderly people. If you have budibab chugarasman, थोड़ा सा दपुन की तो निरियो न्याबर ये करियो मास थयो, try not to get them out. आपको खाना उनको खिला दीजिए, and all of that. Let them not go for groceries. Those people you have to be very careful, especially with comorbid condition. Kidney disease hai, liver disease hai, even sort of diabetes hai, uncontrolled, So try not to, they should not be coming out. You should be helping them in whatever possible way. If there is a person who has COVID in your house, he's quarantined, be very careful when you are giving food and everything to them. You need to interact them. You can do Facebook, पर आप interact कर सकते हो अपने कमरे में, अपना phone लेके and all that. You need to talk to them because they don't need to feel isolated कि मेरे को ऐसे ही छोड़ दिया because elderly हैं and all of that. But you also need to be careful अपना N95 पहनिए and minimum interaction. But you can interact. आजकल तो Facebook है, FaceTime बोलते हैं, वो सब. You need to support them physically and also psychologically, and talk to them over that and tell them everything is okay. Monitor, have a saturation oximeter and all of that. Oximeter पर मेरे को याद आया कि अगर nail polish है तो nail polish से को हटानी है, and oximeter उससे देखना है, because that can screw numbers ठीक नहीं आएंगे अगर nail polish है. तो ladies का एक थोड़ा सा बाद में आप फिर से लगा सकते हैं जब कोविड खत्म हो जाए, तो nail polish वो कर दीजिए. और ये जो पल्स ऑक्सीमीटर होते हैं, जब ये बहुत लो हो जाता है, then they are not reliable. So 80s, 90s is fine, but it's a very good tool to monitor what's happening in the lungs, and whether you need of course, whether you need oxygen, whether you need the further intervention. Maybe you need to talk to a doctor and all of that. Local doctors have a big role. You don't have to need to be a pulmonologist. We have all doctors have enough experience. Ab ek saal ho gaya. And so they have a lot of experience. So connect with your local doctors. There are doctors in every mohalla and every place in India right now, especially in the cities, and jo B city aap bolte hain udhar mein bhi, jaise Jammu mein. So they're very active. And then not probably have a team, jaise KP volunteers, I will name them because they are doing a wonderful job. Wo to dino raat kaam kar rahe hain like crazy. I actually worry for them. Bhai apna mask theek se lagao and make sure that you are healthy. So you need to have like a group like this ki jo oxygen distribution, right? Unke paas 5, 6, 7, 10 jitne bhi hain. And then they get a call, acha mujhko chahiye, and all of that. And they're pretty educated. So wo log oxygen wo kar bhi dete hain and all of that, but they have to be careful ki wo apna pura protective gear pehne and all of that. If it is a concentrator they are delivering, for example, wo to pura self hi hota hai. There is, you don't need to have a flow meter and all of that. If you're delivering a concentrator, they can leave it outside, right? They can leave it outside. The family can pick it up and that sort of a thing, especially the person who is corona positive is picking it up. So minimum interaction and that sort of a thing. So yeah, that's about it.
That is the, so coming back to, I think, this CT scan. I mean, what are the things that are going to be picked up on the CT scan? Just in plain terms, we don't want to go through the technical details. But what are the indicators on the CT scan that the things are not quite good?
ओके सो सीटी स्कैन, जब आप सीटी स्कैन देखते हो तो बीच में आपको व्हाइट सा हार्ट मिलता है, और जो बाकी जो और व्हाइट होते हैं रिब्स एंड ऑल ऑफ दैट एंड लाइनिंग ऑफ द लंग व्हिच यू कैन नॉट सी बट यू सी द रिफ्लेक्शन. जो एयर है, मैक्सिमम एयर में लंग होती है वो ब्लैक होती है, राइट? ब्लैक होती है. सो जब कोरोना हो जाता है, ऑल दीज इन्फ्लेमेशन हो जाता है लंग में. सो क्लासिकल थिंग्स दैट वी सी इज हेजीनेस, पैची हेजीनेस होती है. उसको हम बोलते हैं ग्राउंड ग्लास ओपेसिटीज, बिकॉज वो ग्राउंड ग्लास जैसे लगता है. सो वो होती है. कभी नॉड्यूलर डेंसिटीज हो सकती है, कभी इन्फिल्ट्रेट्स में जैसे निमोनिया जैसे होता है, वेरी पैची इन डिस्ट्रीब्यूशन, कभी थोड़ा इधर है, दोनों लंग्स में है, ऐसे करके है. सो वो दोज आर द मोस्ट कॉमन थिंग्स. Sometimes we have seen pneumothorax, like an air pocket hota hai upar mein and all of that. Wo fir then doctor will decide on all of that. That becomes a little more technical. But most ground glass, little nodular, we call them infiltrates, वो pneumonia जैसे patchy जैसे करके होता है. और वो जब अगर आप अपने बैक पर लेटे हुए हो, so gravity से वो पूरा बैक पर accumulate हो जाता है. That is the reason for proning. जो आप प्रोन बोलते हो, उस पर तो काफी वीडियोस भी हैं. And that is one thing that will increase your oxygen saturation. That will make, in some healthy people, it may prevent you getting the oxygen, क्योंकि फिर oxygen distribution अच्छे से हो जाता है. तो I think I don't need to go in details because everybody knows कैसे prone करना है.
As you said, there are videos, but that's a very, very good point, because the base of the lung is where the damage is being done, and if oxygen reaches there in time, you can prevent more damage. Is there anything about, because some people have been sent CT scans by a lot of people, and they say, oh, it's in the periphery, bilateral in the periphery, and that is that better or is it worse? It's
I don't think it's better or
lung disease.
It's not better or worse. It depends कि कितना ज़्यादा lung involvement हुआ है. I know in India में वो co-rads करते हैं, यहाँ पर तो करते भी नहीं हैं. We don't do that. We just say कि अच्छा it is involvement, mild, moderate, severe, and that sort of a thing. So it doesn't matter periphery में हो, कहाँ पर भी हो. What matters more is कि आपका oxygen level कितना है. चाहे अगर आपका periphery में है oxygen 98 है, doesn't matter. अगर आपका base में है and oxygen level 94 से नीचे है, that is more important than, those are things for just for research purposes and just inquisitiveness and that sort of thing.
As you said, in India there is a score they use, which we don't use it in the West. It's difficult to kind of pick up from the score. I mean, on a layman terms, the higher the score, obviously the
worse it is. Yeah.
So it is kind of in that easy terms. So Nijat, you have a question?
Yeah, I have a question about this. So what about the patients who have some chronic lung ailment, or are asthmatic, or anything, any distress on a day-to-day routine? Do you have any specific tips for them to avoid? Not that whatever we are following, I guess they have to follow, but is there anything very particularly specific for these kinds of patients that they can follow and try and stay out of this?
Yes. So there are 2 or 3 things. First thing is get vaccinated, because I think सब जगह में, सारे countries में, even if you are younger but you have comorbid conditions, they will allow you vaccination first. So get vaccinated, wear a mask, preferably wear an N95 mask, do not go out. And if you are on oxygen, if you have chronic lung disease, that you are on what we call long-term oxygen therapy, LTOT. If you're on that, if let's say you're on 2 liters and your oxygen saturation run 92%, agar aapko corona ho gaya, you do not aim more than 90. And I'll tell you why. And this holds true for in general also. 90 more is not better. In oxygen, more is not better. When अगर आप oxygen dissociation curve देखते हो, 90 के बाद वो plateau हो जाता है. 90 के बाद there is no added benefit. Under certain circumstances, that's जब आप hospital, that's a different story. We will not go into that. But 90 के बाद कोई benefit नहीं होता. Actually, there is something called oxygen toxicity. आपको example I will give you that जो Stevie Wonder है, he's blind. He's blind because he had retrolental fibroplasia. Because he was put in an oxygen tent. उस जमाने में oxygen tent लगाते थे. अब हमको पता लग गया इतना oxygen देना अच्छा नहीं है. Adults में नहीं होता है, but just to give you an example. So उन लोगों में जो asthma है, उनमें very careful, do not give too much oxygen because जो उनका drive होता है breathing के लिए, आपको और मेरे में carbon dioxide is the drive. उन लोगों में COPD asthma में hypoxic drive होता है. So hypoxia में low oxygen. So अगर आपने उसको काफी सारा ऑक्सीजन दे दिया तो ब्रेन सोचता है, ओ मुझे तो बहुत ऑक्सीजन मिला, मैं तो बहुत ठीक हूँ, मुझे ज्यादा ब्रीथ करने की जरूरत नहीं है, तो उससे CO2 हाई हो जाता है. Carbon dioxide narcosis, which is very dangerous. You can go into coma and all of that. This is very, very, very important for people with COPD, on oxygen, without oxygen, or asthma. But this also holds true that the oxygen 90-91% है, you do not need 98 जब patient ventilator पर होता है. I'll give you this example. और let's say बहुत sick है, 100% ऑक्सीजन है, हम लोग पहली चीज पल्मोनोलॉजिस्ट देखते हैं कैसे उसका ऑक्सीजन कम करना है, उसको क्या क्या चीजें दे सकते हैं, LASIK दे सकते हैं, मेडिसिन दे सकते हैं कि उसका फ्लूइड कम हो जाए, कि किसी तरह उसका, बिकॉज वी नो दैट ऑक्सीजन टॉक्सिसिटी इज अ बिग प्रॉब्लम. साइटोकाइन स्टॉर्म होता है और सब चीजें होती है. We do not know कि exactly what is the safe level of oxygen. Most pulmonologist consensus है कि 50-55 तक आ जाए तो शायद safe है, but जितना नीचे आए उतना अच्छा है. So more क्या हो रहा है सब जगह में, people are getting crazy, they are getting oxygen tanks in their houses, they're cranking it up to 5 liters, they probably don't need 5 liters. Once you're 90-91, it is good enough.
Very, very, very informative. Actually, this is the kind of information we want to share with everyone, because I think it's a lot of panic that's putting everybody kind of in, in that mode where they want to have everything at home and address it. But please don't do anything without consulting a doctor, without consulting a specialist, because you're not going to help that patient.
You may harm. The first thing हमको medical college में क्या सिखाते हैं? Do no harm. First thing is so giving too much medicine, giving too much oxygen, that is also not good. One thing I would like to mention is ये हम लोग COPD में across the board करते हैं. अगर आपको COPD और asthma है, and this holds true for even non-lung patients. Let's say आपको थोड़ा शाख खसान, तम साथ क्या चुकासान, पैनिक चुकासान, पच इंसान करा, उससे क्या होता है, we call that breath stacking. So आपने शाह अंदर लिया, but you have not allowed yourself to exhale. So there is carbon dioxide retention और वो पैंट नहीं करना, तो उसमें क्या कर सकते हो? First of all, you try to calm down, like take a deep breath, and what you do is called pursed lip breathing. Okay. What that is you take a deep breath through the nose, close your mouth. When you are exhaling, you pucker your lips. उससे क्या होता है कि positive pressure बनता है पीछे में alveoli में, उससे you expel the dead air. वो कार्बन डाइऑक्साइड एक्सपेल करता है. सो इवन जब हम बैग वाल्व रिससिटेट करते हैं पेशेंट को, हम कुचुक नहीं करते हैं, हम लोग धीरे धीरे करते हैं. क्यों? यू नीड दैट एक्सलेशन ऑल्सो, अदरवाइज कार्बन डाइऑक्साइड बिल्डअप होता है. सो वो पर्स लिप ब्रीदिंग होता है. व्हाट आई टेल माय पेशेंट, इजी टू रिमेंबर, इज स्मेल द रोजेस, blow the candles. Smell the roses, blow the candles. That is a very good technique. Actually, you will see in COPD asthma patient, अगर उनको थोड़ा low चल रहा है, 88-89 है, वो आए आपके ऑफिस में, क्लिनिक में, and then you tell them, do perspirate, let's smell the roses, blow the candles. उसका आराम से 1-2 point ऊपर आ ही जाता है, even more sometimes, depending on how bad or how bad their lungs are. So this is something that everybody can do. So prone positioning, smell the roses, blow the candles. That everybody can do, especially, you don't have, if you have normal lungs, don't start, ab kya hoga, trend chalegi internet par. Chalo ji, you don't have to do that. Only if you have diseased lung, that normal lungs go, you're okay, you don't need to do that. But that are two things, proning, this one, and oxygen zyada nahi lagana hai. 90-91 is good enough. Unless unless you have heart disease or something, then you are, under the care of a doctor or the hospital.
Yes. And now with breathlessness, there is now the symptoms are kind of, we're going through the illness and the symptoms are progressing, and so then you're short of breath and things like that. So what is the role of BiPAP and CPAP machines in that situation? We're talking about symptoms now getting a bit worse.
So let's say you are on oxygen. So you're on 2 liters, 3 liters, chalo oxygen thoda aur bhi ho gaya, aapko 4 or 5 liters. There is the CPAPs, the oxygen concentrators only go up to 6 liters. There are concentrators that go up to 10 liters also. I think they're available in India as well. So when you are starting to have 5, 6 se zyada hai, and then you are tiring out, ki aapke muscles nahi kar pa rahe, then CPAP or BiPAP may be a consideration. CPAP or BiPAP mein difference ye hai, CPAP is ek pressure hota hai, 10 centimeters or 12. That is more used for, CPAP is traditionally used for sleep apnea. Kuch logon ko sleep apnea hoga, they will be on CPAP at night. That acts like a splint in the airway. So airway jab collapse hoti hai or sleep apnea mein, वो उसको open रखता है. That is CPAP, that is continuous pressure. You can add oxygen to that. And जैसे आपको congestive heart failure, sometimes we do add CPAP there. When differential pressure होता है, inspiration and expiration में differential pressure होता है, उसको BiPAP बोलते हैं. अगर BiPAP है, उसको अगर दोनों pressure equal कर दो, तो वो CPAP होता है. So when you are tiring out or oxygen level is low, so this is forced, एक तो forced air डालता है. तो जो आपके alveoli भरे हुए हैं उससे, तो उसमें थोड़ा सा उसको जगह मिल जाती है, oxygen जाता है. So you can oxygen or BiPAP लगा सकते. By the time you need BiPAP, you probably should be in the hospital. Now अब जब bed नहीं मिल रहे हैं, so you could do that because this is a pandemic situation. Maybe never advocate. अब तो like where I train, हम बोलते थे BiPAP दे ही नहीं सकते जब तक pulmonology consult नहीं हो. अब वो थोड़ा सा everybody got familiar that I'm talking about 20 years ago. But now, I mean, if you don't have beds, you can do BiPAP at home. The only thing is you should not be doing BiPAP अगर patient alert नहीं है.
Yes.
If they are obtunded, if they are kind of drowsy. The reason is if they vomit in the BiPAP and they aspirate, they get aspiration pneumonia, then that is a disaster. So alert hai, wo banda alert hai, ठीक पर छो, काक बात छो करान. So CPAP to take, BiPAP to take, you should be consulting a doctor by then. I mean, you cannot do this on your own. So ideally, BiPAP में क्या होता है, हम लोग blood gases लेते हैं. जो यहाँ से जो इधर artery होती है, उससे blood gases लेते हैं. वो फिर मॉनिटर करते हैं कि प्रेशर इंक्रीज करना है, डिक्रीज करना है. उसमें जो लोअर प्रेशर होता है, that is to open the alveoli. The ऊपर वाला प्रेशर होता है, that is for to give you enough tidal, वो हम बोलते हैं tidal volume, इतना वॉल्यूम हो रहा जा रहा है lungs में of air, and of course that is connected to the oxygen. So that oxygen वाला part भी हमको देखना होता है कि इतना ऑक्सीजन दे रहे हैं, ज्यादा तो नहीं दे रहे हैं, and that sort of a thing. And there are BiPAP modes available. India में भी है, वो automatic होता है, वो they adjust to the flow and all of that, but still need a supervision. I don't know, India में respiratory therapist होते कि नहीं? Respiratory therapist.
Yes, there are.
So they're also very knowledgeable. Actually, if there is a respiratory therapist, and he can just talk to the doctor, and then that sort of a thing can be arranged.
Yes.
So those are the different. So there is oxygen nasal cannula, then there is high flow nasal cannula, there is CPAP, BiPAP, and then there is the mechanical ventilation.
So what we are saying is CPAP, BiPAP, they can be used with. They just push the air in. So
They just push the air.
अगर तो हैकत नहीं है, सांस लेने, because you get fatigue.
We call it increased work of breathing. So जैसे आप 20-30 times breathe करें, oxygen लगा हुआ, you cannot sustain 30 times breathing at for a long periods of time. So वो क्या होता है, it takes over the work of breathing. वो आपको थोड़ा सा push करेगा, so you don't have to do. When you see this going on for a while, that is the time to get on the BiPAP or the CPAP, that's a time to actually call hospital.
Again,
And
the patient has the person has to be conscious, like it doesn't
has
have
to be conscious. Yeah, has to, because if they're unconscious and they are kind of unconscious भी नहीं, मतलब कि थोड़ा like confusion जैसे है वो है, they won't be able to tell you मेरे को vomiting आ रही है तो एकदम से करना है. You know, so you don't want to vomit in the BiPAP, वो फिर पूरा अंदर चला जाएगा. और as that is the first thing you, जब BiPAP लगाते हैं पहले thing checklist होती है, patient is alert, check, that is the first thing you check. So yes.
Points. Yeah, great points. Go ahead.
Yeah. So so some people have asked about nebulizers, which are not indicated, but can you tell us a bit more why nebulizers should not be used?
Nebulizers are not used. That's a big no-no. Nebulizers should not be used because वो aerosol generate करते हैं. अगर आपने कभी देखा हो वो छोटा सा कप होता है और वो ट्यूबिंग होती है, वो pressurized air होती है. So उस कप में it generates particles. So if a corona patient, just imagine corona patient है और आप nebulizer दे रहे हो, वो सारा जगह फैलेगा. वो कोरोना पूरे particles फैल रहे हैं और जो आदमी दे रहा है उसको भी कोरोना हो जाएगा. So we do not advocate. It is absolutely no nebulizers are needed. What do you do in that situation? You need MDIs, जो inhaler होते हैं ना, जो asthma के inhaler, वो corona में there is a Lancet की study है that budesonide, उसको बोलते हैं Budecort, I think India में Budecort बोलते हैं, that is supposed to help. So that you can do. Yes. Now, if a person has arthritis है, वो नहीं कर सकता है, so there are something called spacers. वो एक ट्यूब जैसे होता है, yes. तो इस साइड से वो डालते हैं, उस साइड से, so you don't have to coordinate. और वो इतना अगर उससे आपको नहीं हो रहा, आपके उसमें arthritis है, so spacers are available everywhere, so you put on this side. वो एक ट्यूब जैसी होती है, ऐसे करके. वो बच्चों में भी लगाते हैं, because बच्चों का coordination इतना नहीं हो सकता, so that you can use with a spacer and all of that. वो आप उधर bedside पर रखिए, every 12 hours you do this budesonide, and that is the only thing. Now, in certain situations, जब patient बहुत नहीं कर सकता है, you could use it. I don't even want to go over there because, but you have to be in a negative pressure room. The person who is doing the nebulizer has to be full PPE and all that. But for general purposes, no nebulizers, just inhalers only.
Yes, because they do generate aerosol, as you said.
Aerosol. Mm-hmm.
And then, you know, going on from the BiPAP, because you are a critical care ICU consultant, unfortunately, some people will have to be taken to the ICU. So what are the key indicators where we kind of have to think, now this person needs an ICU and cannot be managed in a normal bed or at home?
Yes. So if they are tiring on BiPAP भी काम नहीं कर रहा है तो, you know, intubation. We tried to delay intubation because एक बार उसमें ventilator हो गए, then the you know, results are not that good. Yeah. So you try as much as you can BiPAP, but there are certain circumstances like BiPAP पर है, suddenly the patient is obtunded, you know, he is, so that time you don't have a choice. So उसमें I mean, this is more for doctors. जब intubate करते हैं, you have to have proper PE, or there are different designs कि पूरा cover किया गया है patient को, you know, plastic, उससे आप वहाँ से जाके intubate कर रहे हो और उसको mechanical ventilation पर डाल रहे हो and all of that. So there are circumstances that patient unfortunately will need once they are failing CPAP or BiPAP. Sometimes even when you're let's say आप hospital में हो और ऑक्सीजन लेवल एकदम से कम हो गई और आप थोड़े से यू नो obtunded होने लगे, थोड़ा सा आपका मेंटल स्टेटस लो होने लग गया, that is a physician's decision on bedside. Those people sometimes not even in corona, non-corona also, कभी-कभी intubate करना पड़ता है. एकदम से deteriorate हो गया because you don't have time, you know, and all of that. You have you know, tube डाला, वो endotracheal tube होती है, वो डाला, you hook it on to attached to the mechanical ventilation, and वो ventilator जो होता है वो आपको tidal volume देता है, oxygen देता है, whatever. You can do a lot of things with that. And for the mechanical ventilation, जो ventilator होता है, you have to be sedated because it's very uncomfortable and all of that. So you are given medicines, different medicines are there. वो सब फिर ICU में होता है.
Yes. But what doctors try to do is prevent people from going to ICU. So once person gets in the ICU, then the prognosis is slightly more guarded. So all attempts are made to, I think, to stop people.
To stop all of that as much. When it is, then you don't. Sometimes you don't have a choice. You know, absolutely. Especially comorbid conditions है, किसी को let's say heart disease है, or diabetes भी है, or blood pressure भी है. So बहुत सारी चीजें वो एकदम से, you know, उसका oxygen level. So say floor पर, regular floor पर है, ICU में नहीं है. So say he's on 5 liters, and suddenly you see drop in 60%. you do not wait.
You have
You
no
just,
choice.
you don't have a choice. So and sometimes it's not jo ventilator par gaya wo nahi hoga. We have a colleague in United Kingdom, London mein. I have a colleague, my friend, I wouldn't take the name or anything, but he was on the ventilator for a long time. Usko trach bhi hui thi and all of that. He's up and about, he's doing fine. So it is not that people.
We had lots of cases on ECMO as well. That's the next step after ventilation. We had someone for 6 weeks, and then
that was actually what I was going to ask Dr. Kaul. What's the success rate of people who go on ventilators, and what's your experience? Because you've been in this since last year, been constantly with such patients, and you just mentioned one of your colleagues. But overall, I mean, so that
overall, yeah, if you are younger and you have no lung disease, your chances are still good. So there are people who have done extremely well. They're in their 50s or something. Now, if you are older, if you have lung disease, if you have comorbid conditions, then, the spectrum goes to the other side. So there is a little, agar aap younger ho or no comorbid condition, no lung disease, you're not a smoker, your chances are still okay, still very good. Chances are still very good. If you go further down that spectrum, more active smoker hai or corona ho gaya, COPD hai ya asthma hai or home oxygen par hai, heart disease hai, wo sab hai. So it just adds on. Those people are very hard to get off the ventilator. Just for example, मेरा एक patient है, वो 5 liters oxygen, उसको pulmonary fibrosis है. उसको तो मैंने बोला तू अपना एक ना कमरे में बैठ, तू बाहर निकल ही नहीं. बिल्कुल ही don't, because that's a death sentence. अगर देखो कोरोना हो गया, you cannot. 5 liters पहले से ये तो that sort of a thing. So those situations are there.
There's no room to do it. But in a lot of cases, they have been life-saving. People, some of my close friends, they have come back from ICU 7-8 weeks ICU. These are life-saving devices.
They are life-saving, definitely.
And there's no option. Then you have to save the life somehow.
These are life-saving devices in the appropriate context. और एक और बात भी है कि I tell everybody, mechanical ventilation, जो ventilator बोलते हैं, mechanical ventilation is not a treatment modality. It is a tool to buy time.
Sure.
Till your body heals, till physicians give you जो भी medicine steroids दे रहे हैं, जो भी सब कुछ supportive care दे रहे हैं, mechanical ventilation is not a treatment, it is a tool to buy time. And you need time at that point. So is oxygen. So you sustain the body with external oxygen जब आपकी खुद body heal कर रही है, and it is getting better. One thing I would like to mention is जैसे आपको pneumonia है, चलो छोड़ो कोविड को, जैसे रेगुलर निमोनिया है, निमोनिया कैसे ठीक होता है? डॉक्टर आपको एंटीबायोटिक देता है, राइट? एंटीबायोटिक से क्या होता है? एंटीबायोटिक से बैक्टीरिया किल हो जाता है. बट हाउ डू यू गेट बेटर? The antibiotics does not heal. You know how you heal? Your own body heals it. The doctor, nurses has nothing to do with it. Human body has a mechanism built inside कि वो अपने आप को heal करना चाहता है. Every cell wants to be healthy. ये सदगुरु जी भी बोलते हैं. Every cell is designed to be healthy. So you just have to support during these critical times. And just another example I will give is to sort of elevate people's anxiety. ये जो mechanism, human mechanism जो भगवान ने creator ने बनाया है, it is so sophisticated. आपका एक कट होता है यहाँ पर, right? कितने सारे लोगों को कट होता है, कभी चाकू से हो गया, कभी सब्जी काटी यहाँ हो गया. आपने कभी देखा है कि इस कट पर कभी नोज पैदा हो गई या कभी आपका ईयर हो गया? कभी देखा in the history of mankind? You have never seen this. Why? There is an intelligence here which is inbuilt into our system that tells this to make only skin. No, you cannot make a nose. So there is an inbuilt system. Yes, there's an infection. Yes, it is raging across the world and all of that. But if we just keep that in mind, or मैं एक चीज करती हूँ जब when patients are on even non-corona के time में patients are on the ventilator, मैं crazy चीज करती हूँ. वो ventilator पर है, sedated है, मैं उनके कान में कभी-कभी और जोर से भी बोलती हूँ, heal, we are here to help you. Because they can sometimes still hear you. That makes, I think there are no studies to guide that. You have to support the patient. Because अगर patient ही give up कर गया, so then half the battle is lost. You have to. That plays a big role because आप डरोगे ना, तो डर से आपकी immunity कम हो जाएगी. So you have to stay positive. You have to tell people around you, spread positivity. Don't watch too much television, and don't spread false news. That doesn't help anybody.
Absolutely.
Yes. So we have got a ICU consultant coming in tomorrow. I will say the same thing. He's a good friend of mine. So that's where the nurses and the other people come. Just spread positivity. Even though the patient is unconscious, we think they can't hear you, but they are able to hear you.
They're able to, because
patients, when they wake up, they say, you said these things in my ear.
Because वो पूरे coma में नहीं डालते हम उनको. We just put them on light sedation because we don't want them totally paralyzed के जैसे नहीं. And we wake them every day in the morning. We call them wake up and breathe trials. We wake them and let them breathe on their own. Ventilator लगा होता है, but वो थोड़ी breaths अपने खुद ही लेते हैं. तो उससे हम assess भी कर सकते हैं, mental status assess कर सकते हैं, और उनको sedation vacation बोलते हैं. We give them, because पूरे time आप sedated रहो वो भी अच्छा नहीं है. That is not good in the long term. That increases the stay on the ventilator. That increases, ventilator associated pneumonia hota hai. These are all technical things, but we do wake them up. And some of them, even corona mein, maybe even mild corona case, some of them write notes to us. कुछ छोटा सा notepad दे देते हैं. They're still okay, and they will write notes. I want to, I want something, ice cream or something. I don't think anybody has said ice cream, but I'm just making it up. ऐसे करके तो वो भी होता है. That is good. थोड़ा interaction अच्छा है. So then अगर वहाँ family होती है, but of course corona time में family नहीं है. तो but if you tell them कि I spoke to your loved one, I spoke to your mom outside, and she's, she's there for you, and she's asking about you, all of that. If you see all of that, that makes a big, huge difference.
Absolutely. And that's where all these FaceTime and Zoom and all, you can still use it to get the remote connection with the family members.
Family members, yes.
ICU context.
Very important.
So, Nirjaji, did you have?
Yeah, I have one more question actually about this. So the chronic lung patients or people who have asthma, and they are dealing with their situation anyways, and then they contact corona. What's the long-term effect on? Is there a long-term effect of corona on their health? Because that's also a very big concern for a lot of people.
Yeah. So in COPD, let's take the example of COPD. In COPD, even before corona time, once a patient gets what we call a COPD exacerbation, uska COPD temanchu flare up kasan, flare up, end up in the hospital, they lose some lung function. Even in a non-corona situation, pneumonia ho gaya, exacerbation, flare up of CO, they lose some lung function. That's why hum log rehab karte hain unko, rehab mein dalte. So if you are at here, if you get corona, you go down a little, not only koi infection ho gayi aapko hospital mein aa gaya. Hospitalization itself results in loss of lung function. You may not come back up till here. You may be like that. Now with corona, you cannot predict. Now kuch jo asthma hote hain, jo non-smokers hote hain, they may come out of it fine. I had few patients who just came back to the office after 2 or 3 months. They had, they had corona. Most of them were non-smokers, and they have no issue. Now, there is something called post-COVID syndrome, and we are learning more about them. If there's something called, I don't want to scare people, but जब आपको pulmonary post-corona fibrosis वगैरह हो, then you need the lung specialist. Then, there are different things. There are medicines for that. Many. I'm treating a few of them. Steroids हैं और एक दो और medicines हैं. Antifibrotics बोलते हैं उनको. And that long-term effects क्या है? Will it all clear up? कुछ तो मेरे clear up हो गए. Some of them are just came in, all of that. So this is an ongoing. So it is still like it's a new thing. So हमें but data 10 year का data नहीं है हमारे पास. अब just 1 साल का ही है. So that's why we come back to prevention is better than cure. Prevention, masks, vaccine, mask, hand washing, vaccine. You just go back, just tell your friends, tell your family, and encourage them to get the vaccine. The vaccine का क्या है कि जो Covaxin, India का vaccine है, it is now also effective against the वो जो variants है, mutants हैं. So that is a big thing. ये WHO के chief ने बोला है कि this is a big thing. And just imagine जो poor countries हैं Africa में है, the WHO and all these agencies are saying कि they may not, common people may not get the vaccine till 2023, 2024. So we are very fortunate in US and in India. India में तो खुद ही बना रहे हैं, वो तो world को दे रहे हैं. So this is something to be very proud of. मैं तो यहाँ पर सबको बोलती हूँ, सारे अमेरिकन को बोलती हूँ. इंडिया ने 71 कंट्रीज को दिए. मैं तो पूरा बोलती हूँ, कोई अपसेट हो, 71 कंट्रीज, कोई कंट्री नहीं दे रहा है, यूएसए नहीं दे रहा है, कोई नहीं दे रहा है, इंडिया ही दे रहा है. So that is something to be really proud of, and we are very fortunate कि इंडिया में रह रहे हैं कि अफ्रीका में पता नहीं कितने लोग मरेंगे क्योंकि वैक्सीन नहीं मिलेगा. So take advantage, take the vaccine. May 1 से तो 18 years and above भी हो रहा है. So and take the vaccine yourself. Call 10 people and say आपने लिया, you know, please ले लो and all of that. These vaccines are very safe. They have been tested. All those myths are. I got the vaccine. My whole family has been vaccinated, from a 16-year-old niece to my 83-year-old father. All of us have been vaccinated. So if there was something, मैं क्यों लेती, right?
There's a question about vaccination, actually. Somebody asking that she's on blood thinner for cholesterol every day, and should she take blood thinner on the day of vaccination?
So for cholesterol, you don't need to be on blood
I don't know.
thinner.
That's what the
If
question
you're
is.
on a tour, because यहाँ पर भी जो छोटे-छोटे towns में लोग होते हैं, वो बोलते हैं atorvastatin और statin सारे वो सोचते हैं blood thinner है. So that is not a blood thinner.
I am not
So
sure.
you can, so if it's a statins, you can take. Even if you are on blood thinners, you don't need to stop. You know, aspirin to bilkul stop nahi karna hai. If you're on blood thinners like warfarin hai, and you are taking for a heart valve, agar aapka mechanical valve hai, to bilkul stop nahi karna. Atrial fibrillation hai, you are taking that. यहाँ पर उसको बोलते हैं Xarelto, apixaban or Eliquis है. You don't need to stop any of those, because you know it can cause more trouble. Stroke हो सकता है, वो हो सकता है. You can take blood test. We've been giving these vaccines. जो ये vaccines हैं, वो flu vaccines देते हैं ना, हर साल देते हैं. So people on blood thinners, they take that, no problem.
So that reminds me of a related question, because with corona, there is evidence that can cause coagulopathy, you know, like clotting disorder. Some people have had the DVTs and pulmonary embolism and all. So is that something you have seen? Is there something you need to be mindful of?
Yes, I mean, you know, when you are sick enough and your D dimers are high, that time जो hospital में है उन सबको DVT, हम बोलते हैं DVT prophylaxis, मतलब कि deep venous thrombosis जो embolize होता है वो पहले लेग में होता है और लेग से वो हट के क्लॉट जो होता है वो फिर लंग में जाता है. सो यू नो वी गिव बेली में शॉट्स देते हैं, जो यू नो शॉट्स देते हैं, उसको एनॉक्सिपैरिन बोलते हैं. So that is given for prophylaxis. Now there are certain circumstances that D dimer high ho gaya, and there is evidence that the hypoxia could be related to an active blood clot. There are tests for that. There is a special CAT scan for that. There is also a Doppler of the legs, देखने के कि leg में है. अगर वो positive है तब तो full dose देना है. Whether you are, they are called DOACs, direct oral anticoagulants, वो जो नए वाले हैं उसमें monitor नहीं करना पड़ता. Warfarin है, warfarin तो आजकल कोई देता नहीं है. और low, अगर patient नहीं ले सकता pill से, तो belly में shots होते हैं, and that is a higher dose than DVT prophylaxis. जो prophylaxis का ना हो, blood clot ना हो, उससे ज़्यादा higher dose होता है. Then it becomes an individual case by case basis कि अगर आपका D dimer high है, and वो जो levels होते हैं ना, वो they are different how they do the levels in India and how they do the levels in USA. वो nanogram और वो different होता है. So your lab and your doctor will tell you अगर वो high certain level है, cut off level है, तो then you are kept on anticoagulation. वो pills लेने होते हैं for anywhere from 2 weeks to 4 weeks. I have done different things for different people. It also depends आपके कितने comorbid conditions है and that sort of a thing. Because some we are seeing कि वो ठीक हो गए, कोरोना हो गया, ठीक हो गया, चले गए घर, and they're having blood clots. सारे नहीं होते हैं, बहुत कम होते हैं. और जो ये new strain है, we don't know कि अब कैसे. I have not seen any of the new strains, so I don't know. So I talk to people in India, तो जितने भी doctors वगैरह है, sort of it is case by case right now. It's still evolving. But yes, it is a procoagulant state. जो पहले से ही जिनको problem है, उनको ज़्यादा careful रहना, वो doctor आपके लिए monitor करेगा hospital में.
Yes, so because the thing is, when people get a positive test, it's best not to just keep lying down in bed, you know, because that a bit of exercise even in the room,
yeah,
it's a hypercoagulable state. So
yes,
if you're just going to sit and not move at all, you know,
bed rest तो करना नहीं है.
In the mild stage, it's not going to help, is it?
Yeah, you just try to walk around in around the bed, थोड़ा उठे बैठे, ज़्यादा आप exercise वगैरह आप treadmill पर चढ़ जाओ ऐसे नहीं है, but you know little bit, and then I think एक वो there are some videos online how to do your prone करो, left lateral करो, left, you know, sort of move around and that sort of a thing. Stay active, but not but do not exercise, do not get on the treadmill. I will tell you why. in some people, this coronavirus is affecting the myocardium, the heart ka muscle. Not everybody, we don't know. It's because I have seen a lot of people that have, उनका heart rate low होता है, ठीक हो जाता है, but 40s में चला जाता है, just nothing, उनको corona है, आप देख रहे हो, monitor पर देख रहे हो. So it is causing some kind of, it's causing myocarditis, it is causing some muscle damage, जो बाकी most of the time ठीक हो जाता है. So you do not want to be, even after corona से ठीक हो गए, घर आ गए, for 3 to 4 weeks, do not get on the treadmill, especially those young people who are into this fitness fad. There is no need to do, अब थोड़ा time दीजिए और धीरे धीरे add on धीरे धीरे, especially आपको fatigue है, because usually you can have silent heart disease because of corona. So even young people, old people. So you be very careful. अगर कुछ problem आ रही है, then consult your doctor, but do not go exercising on a treadmill just after you've been discharged from the hospital. Take it slow, at least for the next few weeks, because we have seen people dying because of this condition.
Yes, absolutely. Myocarditis and strokes and PI. So best to take it easy.
Sunita,
do you have some questions from the audience?
I think she pretty much answered that. I had a question about the correlation between COVID and then its impact on other organs like heart being the major one. Like, are there any chances that it can lead to heart attacks? I think a few of the patients died because of heart attack while they had contacted this COVID. So would you like to say a little more about it? Or
if you are young and if you are pretty healthy, even if you have a little heart ho gaya, now har ek ko test nahi kar rahe heart ke liye, you pretty much recover. वो problem आ जाती है जब when you're older, you already have heart disease, you've had जैसे को bypass surgery हुई है, even किसी को bypass surgery, heart is still good, it's just functioning, muscle is strong, they still do okay. यहाँ पर तो बहुत heart, everybody after the age of 65 को bypass surgery होती है, I should not say everybody, but it's very common. So those people, taking their example, that people do very well. Now problem comes in आपका ejection, जो heart muscle pump है, उसको हम ejection fraction बोलते हैं. अब कई लोगों का बहुत कम होता है, 20% ही है, but it's very very low. They are, they can get a heart attack, they can get arrhythmias just because उनका underlying condition is already really really bad. जो slow heart rate है, वो मैंने बहुत देखा normal patient में, but होता कुछ नहीं है, वो recover कर जाते हैं. You don't have to even do anything. वो 40s में 45 रहता है, जैसे किसी का 90 था, right? चलते फिरते 90 था, COVID हो गया, ventilator पर है या सिर्फ ऑक्सीजन पर है, you will see that उसका 40-45 में जा रहा है. So we have called the cardiologist, we have consulted with them and they've said nothing. वो बोलते कुछ नहीं करने का. अगर वो really उनको heart block है, तब तो pacemaker लगाने का है. लेकिन अगर they are asymptomatic, वो अपने आप खुद ही recover हो जाता है most of the time. That is my experience.
Yeah, so you have to give it time. It's like with the post-COVID syndrome, some people are having it, but over time things are slowly getting better.
Fatigue भी बहुत हो रहा है लोगों को, because आप ventilator पर हो या ज़्यादा you have not been moving around. So even without COVID, there is something called critical care illness myopathy. तो उनको muscles weak हो जाते हैं, so fatigue होता है, वो धीरे धीरे ठीक हो जाता है. If it is too much, that's where physical therapy. So there is no pill कि आपका muscle, एकदम से ठीक हो जाएगा. The therapy for that physical therapy is a very very big, plays a very big role. आप घर में भी कर सकते हो. अब तो इंटरनेट पे इतने सारे ठीक है, कौन सा stretching bands होते हैं, walking करना, treadmill करो थोड़ा सा, but after 4 weeks. After 4 weeks, शुरू में एकदम से नहीं, शुरू में आप walk वगैरह कर सकती हो, strenuous exercise नहीं, धीरे धीरे. And sometimes people are put in rehab, वो इंडिया में भी होते हैं, physiotherapist होते हैं, they can guide you and maybe you can have a consultation with them कि थोड़ा सा क्या exercises करनी, क्या है. Stretching bands होते हैं, there are those वो किसी भी sports store में मिलते हैं, वो stretchy bands होते हैं, तो वो आप उसको जो दरवाजे की वो handle होती है ना, उस पर लगा लो और थोड़ा थोड़ा सा ऐसे करके, तो उससे आपके ये वाले muscles भी वो हो जाते हैं. It takes time, but then good nutrition. You make sure you have enough protein in your diet, make sure you don't have junk food, drink a lot of fluids, try not to drink those cokes. I have a pet peeve for these cokes and coke products. नींबू पानी पियो, दूध पियो, लस्सी पियो, सामन वामन खाओ, थोड़ी कले सामन खाओ, थोड़ा उससे leather से बढ़ जान.
There are two questions related to vaccination, and let's answer that because you're not on Facebook, so I would not want you to be there. And because one is, what's the maximum duration period between first dose and second dose of vaccination? Because that's important.
So India में वो बोल रहे जैसे मेरे को लगा था about 28 days, मेरे को second वाला लगा था Pfizer का, father का भी same thing about 20, like that. But they are saying 6 to 8 weeks for the co-vaccine and Covishield. Now, I think in India, they're saying 6 to 8 weeks, usse immunity zyada hoti hai. Yes.
And another one, same thing. How long is this vaccine going to, create that immunity in your body to fight?
So this vaccine, actually, the mRNA जो vaccine है, so वो आपकी memory में हो जाता है. So, it is going to be definitely for 6 years, 1 year, maybe more. We don't know. So we will come to know. जैसे वो वाला flu vaccine है, वो आपको yearly लगाना पड़ता है क्योंकि वो mutation होती है. इसमें so far what we are seeing, अगर mutation हुई भी है, वो उन कोरोना को अपना spike protein चाहिए infection करने के लिए, तो वो अपना spike protein बंद नहीं करेगा. So most likely, we would not need modification and all of that, but that's an evolving thing. It lasts definitely for a long period of time. We don't know whether it definitely will last more than 6 months, definitely, maybe a year, maybe more. That remains to be seen. But, जब आप vaccinated होते हो, तो आपकी जो memory बन जाती है immune उसमें. So it is supposed to be there for a long time. Unlike those antibodies from the plasma, जो plasma मिलता है उसमें antibody वो खत्म हो जाती है. It is not yours, वो किसी और की है, बनी बनाई है. ये आप खुद बनाते हो. So that memory is there. Memory cells में वो memory रहती है कि मुझे ऐसा बनाना है. या और बनी बनाई होती है antibodies.
That's a wonderful point, actually, because we've been talking about this plasma a whole lot. So that's a very good point you just mentioned there, and that's knowledge for me also. I mean, for everybody else, but for me also, it's good knowledge. So Shafalika,
so how long the immunity, that I guess is an unknown question.
It's sort of an unknown question. There are various theories, so it may last longer because that is a very new mRNA is a very new technology. So it should, I mean.
Yeah, or like flu, we might need a yearly vaccine.
Yeah, because flu वो mutate करता है, वो पूरा उसको change हो जाता है. तो for here, which is more directed towards, spike protein के against antibodies होती है. So long वो spike protein है, तो we may not need. And well, there is another वो nasal vaccine निकला है, Bharat Biotech का, right? So it will protect you, vaccinate you, and also will not allow you to spread it to others. That's what I've read. So that may be a big thing as well.
So research, there's a pill, there's a tablet coming up as well. So thank you, Dr. Anupama. It was wonderful to have you with us today. And आपने बहुत अच्छी तरह समझाया. Really impressed.
Yes.
I'm really blessed. I'm so fortunate, and I'm so happy to be talking to you all. You're all, my family. We are all in this together. You can call me anytime through one of these guys. I am in a lot of WhatsApp groups. You can, text me through there. We also have a KOA on-call group. आपको पता होगा on-call group है जो US से हम लोग जो doctors हैं, Kashmiri Mandit doctors हैं, वो हम लोग call ले रहे हैं. Like for example, today I am 1 to 5 मेरा वो slot है. So we pick up slots. It's almost 24/7 coverage. And it is, I don't know exactly कैसे coordinate होता है. I'm not that tech savvy. So वो हो रहा है. So you have all the support. We will, like आज जैसे आपने बोला जो UK में है या Germany में है, so you guys are sending oxygen tanks, and we will try from here as well. So there is all kinds of support. Don't lose heart. We will get this together. We are in this together. We will get through this. India ने इससे भी ज़्यादा कुछ झेला है, और India has always come on the top. Always. So blessed to be talking to you.
Thank you so much, Anupama.
Har Mahadev.
This was a great session, great interactive session, and also just language में आपने मुझे से general public के लिए बात की. I think that's very effective. And also kudos to all of you, the medical fraternity who has been on call. I think a lot of people don't know that most of you are on calls with the folks in India, and that's really commendable. We're not doing anybody any favor. It's all about the community, whatever little way we can help them. We are here. I am the support. I will connect you guys and let you talk to them and answer their questions. If I have any questions that popped up after our interaction, I'll
Sure.
send it to you and we'll answer those. So thank you so much to all the volunteer teams. Once again, stay safe.
Stay safe.
Qanun Tezo Khayal,
Well,
Toite Tezo Khayal, and Namaskar.
Namaskar. Namaskar to all of